Hello, everybody. Welcome. This is the Thyroid Pharmacist Healing Conversations podcast. I'm so excited to be here with a really good friend of mine, Dr. Roy Steinbock. He is a pediatrician and he's joining us from Boulder, Colorado. Hi, Roy. How are you doing?
Good. I'm doing good. How about you?
So far, so good. So I wanted to tell you a little bit about Dr. Roy. He's a board certified pediatrician with an integrative and patient centered approach. He believes that investigating the root cause rather than only addressing symptoms is the best route to achieving and maintaining optimal health and well being. Dr. Roy combines evidence based Western medicine with a functional and mindful approach. His areas of expertise includes digestive disorders, allergies, PANDAS, anxiety, obsessive compulsive disorder, ADHD, and other difficult to treat cases. He works with children of all ages and young adults, providing in person care locally in Boulder, Colorado, and offering distance consultations for families across the United States. And most importantly, he was Dimitri's pediatrician when he lived in Colorado. Welcome, Dr. Roy. I'm so excited to have you here. I wanted to find out from you what led you to the decision to become a pediatrician.
So, it's interesting. When I first went to medical school, I actually thought I was going to become an orthopedic surgeon. But very quickly, I realized I don't like the operating room. And a family friend who was an orthopedic surgeon convinced me that I needed to use my brain more, that I was not going to be satisfied just standing there cutting things all day. So that kind of narrowed it down. At that point, I was interested in either internal medicine and pediatrics, and pediatrics just was a lot more fun. The people who were involved in pediatrics tend to be a lot more lighthearted and enjoyable to be around. Plus, kids just bounce back really quickly, which is really fun too. So you get to see, unlike adults who have many, many years of diseases getting them down, children tend to really bounce back from things so quickly, and that was very satisfying. I'd also worked as a teacher, so I did really love just being around kids. So that was my main inspiration for becoming a pediatrician.
I love that. And I wanted to know, when did you become interested in going deeper into thyroid health and mental health as an integrative pediatrician?
So I got really interested in integrative medicine in general, not to date myself, but right around the time Andrew Weil came out with his first book was right when I was finishing my residency. And that got me his first book about integrative medicine. He had plenty of books before that. But that got me really interested. I felt like there was something missing for my medical education. I really felt like it was invaluable, and I learned a lot, and I still use my conventional medicine every day. But I felt like it just didn't teach me anything about basic health, things like how to stay healthy. I'd always been an athlete, and I really was interested in optimizing my own health for biking and feeling fit. And I knew nutrition was a great first place to start. So I started studying nutrition, and then I met naturopaths, chiropractors, osteopaths, all these alternative doctors that turned me on to what at that time, believe it or not, I mean, was initially called holistic medicine or integrative medicine, and then eventually kind of morphed into more like functional medicine. Thyroid, I got really interested in when I started seeing more and more chronically sick kids or kids with weird diagnostic dilemmas, kids who just came with the weirdest symptoms that didn't make any sense. And as you know, thyroid can involve basically everything. And people who have thyroid disorder don't necessarily read the textbook. They come with very strange combination of symptoms often. And same with mental health. I learned really early in medical school that during my psychiatry rotations that you had to rule out thyroid conditions before you could diagnose somebody with even anxiety or depression. So, being a good student, I just started testing people, and people started coming back with positive antibodies. And that got me really interested. Eventually, I diagnosed myself with Hashimoto's and also my wife. And so that got me deeper down the rabbit hole, of course, of learning a lot more and eventually finding you.
Yeah, so a little bit of a backstory. Debbie, Roy, and I, we got to meet in Boulder, Colorado, and we got to nerd out on a lot of different fun things, including thyroid health.
Mhm.
It's incredible that you actually did that. And I know that physicians and psychiatrists are trained to like rule out thyroid disorders before somebody gets diagnosed with an anxiety disorder or depression, so on and so forth. Even like obsessive compulsive disorder has been tied to a thyroid dysfunction, but so few of them actually do that. I know, I know I'm not the only person that had walked into a doctor's office complaining with so many symptoms that seemed like so obvious that they were thyroid related, only to hear like, oh, here's an antidepressant or here's some anxiety meds. And I'm not above medications. I'm a pharmacist, of course, but like, well, why give you all of these meds when actually it's like focusing on your thyroid health is going to be the key to that.
Yeah, I think I totally agree. I think that there's an interesting thing. I have a lot of friends who are in the mental health field, a lot of friends who are psychiatrists, and they're kind of told these days not to examine their patients, and very few of them do any lab work. I think they assume that that's been done before patients come to them, just to kind of defend those people. I think they're not doing it because I think they assume people have a primary care doctor who's doing all that. But I think, unfortunately, I think thyroid, you know this really well. I mean, I think it's one of those things that if you don't look for it and don't look for it frequently, you can easily miss it. Because I know for myself and for Debbie, I had to test myself maybe a half a dozen times before I eventually came back positive, even though I could tell there was something wrong and my symptoms really seemed like they were hypothyroid. Same with Debbie, my wife. We tested her multiple times, and it wasn't until fairly until she felt pretty poorly that her thyroid numbers actually reflected it. So I think it's one of those things that if you don't test frequently, if you don't repeat testing, then you can really miss it. I mean, especially with pediatrics, because I think it's easily missed with kids because A, it's a little less common. But one of the most common times to have autoimmune thyroiditis is during puberty, right? So it's all like the hormone changes: puberty, postpartum, nursing, perimenopause, menopause. Those are the times you really see it in a lot of females, and so I think it's overlooked a lot. I test everybody, anybody who has any, certainly mental health thing, but I really screen almost everybody for thyroid disorder because you will pick them up if you look hard enough.
Yeah, it's kind of interesting. When I was a teenager, I suspect that I probably started getting thyroid symptoms sometime around puberty, right? My mom thought that my thyroid gland was enlarged, and she was a pediatrician in Poland. She ended up taking me to an endocrinologist because she's like, she's kind of tired and she's got this enlarged thyroid. So they tested my thyroid, right? And they said it was normal.
You remember what your TSH was back then? I mean, probably not.
I don't have access to that information at the time.
Right. The interesting to see what was normal.
There are some, I know reference ranges I've seen for kids that are a little bit outrageous. Can you talk to that a little bit more?
Yeah, I think that's one of the. So with adults, I feel like it's just easier because adults are developed and they're not growing, and so their thyroid's more stable. The hard thing with kids is that kids do run higher TSHs because one of the things that the thyroid gland does is it's all about growth metabolism, energy usage in the bottom in the body is kind of how my simple way of looking at it. So what I find is that the thyroid ranges for kids can vary. I mean, some ranges go as high as, even like I've seen as high as 6. I think that's probably considered hypothyroid by most endocrinologists, but many endocrinologists will use 5 as an upper limit. And though that can be normal, I think you have to look at it with symptoms, right? If someone is having symptoms that really look like hypothyroidism and their TSH is getting higher and higher over time, that's why looking at it serially can be helpful. Then that makes me much more suspicious that they're going to develop some kind of thyroiditis. Usually, I mean, most people end up having antibodies, but not everybody. So yeah, so you have to be careful because the range that we think about is optimal for adults, like 0.5 to 1.5 or 2, which worked really well, I think, for most adults. Kids oftentimes are running at 3.5, 4, and they could be totally functioning normally. So you have to really take into account the symptoms, and if the symptoms match hypothyroidism and their thyroid numbers are borderline, then I might be more inclined to treat them.
Do you test thyroid antibodies in kids?
Oh yes, absolutely. So I would say again, it varies. It's not necessarily my screening test. Oftentimes, if I'm don't have a high index of suspicion, I'll just do a TSH. But generally, yes, and usually because I see in kids and actually in postpartum moms, it's even more common where I'll see a combination of Graves and Hashimoto's, so both thyroid stimulating antibodies and either TPO or anti-thyroid globulin antibodies. So I generally will test all three because if you test just hypothyroidism, then you'll miss the Graves. And a lot of time in the beginning, when they're early diagnosis, they're going back and forth between hyper, and it can be very difficult to diagnose it because the TSH is not reliable in those situations. It depends on when you're catching it, right? So
As a pediatrician, you see a lot of postpartum moms. And I know that a lot of postpartum conditions, like mental health conditions like postpartum depression or even postpartum psychosis, they can be related to hormonal issues postpartum. Can you speak to that? What's been your observations with the moms in your practice?
yeah, absolutely. I think, yeah, so I started getting into treating moms postpartum because, of course, the health of the child is very dependent on the health of the mother. So I would ask them how they're doing. And you could just see some of these moms are really struggling. A lot of anxiety, I'd say anxiety, panic attacks, even it can get as far as obsessive compulsive symptoms, maybe not full blown OCD, but just obsessive compulsive. A lot of times rumination, worry, and some of that is normal postpartum, right? Because your nervous system is supposed to be on heightened alert because you're trying to keep this little being alive, and that's super important. And it's a big job that no one's ever trained you how to do. And we don't get the kind of support that we used to do, like when we lived on farms and big groups, right? So some of it's normal, but people know when it's not feeling normal. And when you ask them the right questions, they'll let you know that it's kind of out of their range of even their baseline anxiety, which unfortunately people have too much to start off with. But um, so I started asking questions, and then I would give them like, go get these labs done by your doctor. But most of them would come back and say their doctor didn't want to do the labs, so I just started ordering them myself. And what I found is that if it's really extreme, like the moms that are really struggling, there's a pretty decent high likelihood that their thyroid is off. Not like 50%, but maybe even 30%, I would say, anecdotally. I didn't write this down. I haven't done an exact research paper on this, but I would say anecdotally, the most, dysregulated moms that I see very frequently will end up having Hashimoto's or Graves or a combination of the two. And it can be transient. So there is kind of like this postpartum transient thyroiditis. But most of those moms at some point end up having Hashimoto's later on, is what I've seen, like a much higher number of them. And again, I don't know the stats, but I know it is statistically speaking, and in my experience as well. So yeah, so that's how I got into treating that, and the treatment is complex because on one hand you have to resuscitate the thyroid, right? If they're hypothyroid, you got to get the thyroid back in function. But as you know, and I'm sure experienced personally as well as I have as well, it takes a while before you really feel like yourself. Even once your TSH is in the normal range, I usually tell people I see most people feel a lot better within 3 months of regulating their TSH in a more optimal range. So during that time, that's a long time to wait if you have a new baby and you're having panic attacks and you can't leave the house and you don't feel like yourself. So that's when I'll throw in some supplements and medications, and that's when you really need to use kind of the whole holistic tool belt and look for other things too, because you have to look for things like iron deficiency and even zinc and vitamin D. There's a sort of like the super low hanging fruit that you have to optimize that as well to support the thyroid.
Yeah, there's such a big connection between low ferritin levels and hypothyroidism and Hashimoto's. I feel like I didn't fully appreciate ferritin levels until I was pregnant myself and I started having quote unquote all of these like pregnancy mood swings and insomnia. And then I was found to have, I remember you were over at my house and I was like making some like bloody food with like red sauce. And I'm like, you're like, "Oh, pregnancy cravings, huh?" And I was like, all of this red meat. Like, I would die if my husband didn't get me 2 burgers a day, 2 gluten-free burgers, of course.
Of course.
And it would just be like, "Oh my gosh, I needed that iron so much." I ended up getting some iron supplements, and I felt like a new person. during my pregnancy, but a lot of women will have that postpartum iron depletion that is very well related to how they're able to utilize their thyroid hormone. So thank you so much for bringing that up because I don't know why it just doesn't get enough attention.
In the mental health world, I mean, it's also talk about one of my basic things I always check. I mean, checking a ferritin in Colorado is tricky. So most people at sea level, it's easier because if you have a low ferritin, you're going to probably become anemic. So if someone does a blood count, you'll see that. But at altitude, it's a little trickier. It took me a little while when I moved out here because I trained at sea level. So it took me a while to figure it out. Most people have very high hemoglobin levels, despite having very low ferritins. I just saw a kid who had a 13 hemoglobin, which is well within the range of normal, high for sea level. But his ferritin was 5.5, which is insanely low. Um, and it doesn't make sense that that would work that way. But I think the increase in erythropoietin, your kidneys will basically make you produce more red blood cells. And so you have to check ferritin levels, especially in Colorado. And then also because the lower oxygen level, I think it makes even a bigger difference. Yeah, it's a real deal breaker in terms of mental health as well. If you're not getting enough iron, if you're not getting enough oxygen, which is why what iron binds in our hemoglobin, you're not making enough energy. And if you're not making enough energy, then nothing works well. And certainly it's going to send signals of fight or flight to your nervous system to tell you something's wrong and kind of stimulate this anxiety behavior. So generally, people with low ferritins tend to have more sensitivity, sensory integration in kids, irritability, anxiety, OCD, even depression.
I mean, it's just so eye-opening and so fascinating. I think I just saw an article about anemia connected to ADHD, that it can be impactful on the severity of ADHD and so many different mental health components of it. I know for everybody listening, so there is just like there's a full thyroid panel that we would recommend, such as TSH, free T3, free T4, and the thyroid antibodies. There's a few labs that we would recommend to like really rule out anemia or a full anemia panel. I know ferritin is one of them that I'm a big proponent of because it's the iron storage protein. Can you share some of the other ones that people could request with their doctors?
Yeah, so it's by far the most important is ferritin. And I always will do a blood count when I'm doing a ferritin level as well, because especially with kids who are frequently exposed to infectious disease, you want to actually look at the white blood cell count and the platelets when you're looking at a ferritin level, because ferritin, kind of like an ESR or CRP, which we call acute phase reactants, those jump up when you're feeling sick, when you're inflamed, or if you have some kind of inflammation. So when our body's inflamed, it actually will produce more ferritin as well. And so you can have this falsely elevated ferritin. So if you don't know, so if your kid's sick and you get their blood drawn, you can think their ferritin's normal, but it could be falsely elevated. So that's number one. So I'd say blood count and ferritin are the most important things, but people will also do like iron saturation, total iron binding capacity. I'll be honest with you, I don't find those quite as useful, or and serum iron as well. But I don't find those quite as useful. I think the ferritin and the blood count are really the ones that clinically, and because I'm always trying to conserve how much blood we have to draw for little kids, especially young kids, I really try to minimize what I'm ordering.
That's such a good point because I know if it's like my husband's health we're trying to work on, or an adult's health, we're like, let's order all of these labs. And for little kids, I have a 6-year old that I'm like, let's get some blood work done. And it's not as straightforward as it is to get blood out of him than it is from my husband. Absolutely. I know.
Yeah, it's definitely harder for sure on many levels.
I know a lot of the people, a lot of the women in my community that follow me are always asking about like, how do we, I have thyroid disease or my husband has thyroid disease. Is it is my child higher risk for that? Right.
Yes. Yes. So the answer is yes. They are higher risk. I mean, we don't know of any specific gene. It's not genetic, like let's say like eye color is or celiac or something like that. But there's definitely a familial component. And so we know if you have family members who have thyroid disorder, thyroiditis, then you are more likely. And especially if your father has it, it increases the risk even more. So my kids are super lucky because both myself and my wife have it. So my youngest is she has really good odds, unfortunately. So, but I think there's things you can do. I mean, we're also raising our kids very differently than we got raised. I mean, our parents did our best, or at least I think mine did their best. I think they did as much as they could. But and we are really healthy in general, but we weren't, we were just not exposed to supplements and even purified water and things like that. I mean, we're a lot more conscious. We'll have to see how the next generations do in terms of their thyroid, but we've learned a few things, I think, since the 70s for me at least.
Yeah, I mean, I learned so much from both you and your wife just about all kinds of life hacks and tips, and especially health related. When my husband was diagnosed with ulcerative colitis, you guys were, first group of friends that I called to get some insights, and Debbie really helped me through that, getting him into remission. There's so many things out there that I wish, our parents knew, that I think we are aware of. And so I'm so excited to have you here just to share this information with everybody listening. If you're listening in and you're joining us live, we're going to take some questions. So go ahead and post your questions. We'll be able to see them popping up on the screen and we can get to them. As people are typing up their questions, you know, it's been my observation, but I don't know if it's like necessarily been proven. I try to look for some research on it, but that women with autoimmunity or Hashimoto's or thyroid issues, their children may be at higher risk for certain conditions, especially if perhaps the conditions aren't, managed as well during pregnancy, or maybe the same genes or same environmental factors. Um, I know, has that been your experience or observation as well?
Yeah, definitely. I mean, I think, and it's really multifactorial. I mean, again, like you said, I don't think there's any like real definitive research on that. I think statistically speaking, people who have autoimmunity in their family have a higher risk of autoimmunity in general. And that can be a lot of things. I mean, I think if you're mildly malnourished, maybe that's too harsh of a term. Maybe you have some nutrient insufficiencies like low vitamin D or zinc or iron when you're pregnant. I think those are going to really affect the fetus, especially iron. Again, not to harp on that, but if you're iron deficient, then your baby has a very high chance of being iron deficient. And again, because that's the main way we get energy into our bodies through oxygen bound to iron, it's affects everything. So and there are probably some predispositions in terms of our immune system and how the white blood cells react and how our immune system's regulated. I mean, you do inherit those things directly from your parents. And then even on a mitochondrial level, right? Because mitochondria are inherited directly from your mother. You actually only get them from your mom. So that can have a huge effect as well. And that's also, again, energy production. Energy is how we make our bodies work, and we don't really think of it that much, but it's crucially important. And your body knows when it's not getting enough, and it will put you into, particularly mental health stuff. You get a lot of like panic and anxiety when your body's not getting the energy it needs.
Um, yeah, I've kind of noticed some of the women in my circles, like when they have Hashimoto's, they have their children tend to have more likely to have something like pandas or ADHD. But I've also noticed a big connection between obsessive compulsive disorder and Hashimoto's. Actually, I just wrote a white paper about that. If people listening can comment OCD 101 to get the link about it, because it's just, it can be the first symptom that people see, like anxiety or obsessive compulsive disorder, or like subthreshold obsessive compulsive symptoms they can experience. And in my observations, we do need to approach the thyroid and get the thyroid hormone optimized. But there's also a few other things that might need to be recommended to like really get that under balance. Interestingly, like I've noticed N-acetylcysteine and myo-inositol, which are amazing for thyroid health, they've also been studied for obsessive compulsive disorder, and they can help to kind of bring it all together. Um, What are your strategies? Do you see kids with obsessive compulsive disorder? I know this has been one of your approach or specialties.
Yeah, I wish it wasn't, to be honest with you, because it's so painful to see people who have obsessive compulsive disorder. It's really, really disruptive. And like you said, I mean, a lot of times it's the first thing that will make people come to a doctor. When you start asking questions, it's clear that they've had some thyroid dysfunction for a while before that, but obviously once you get to the point of severe OCD, it can be so painful that you have to seek medical attention. Yeah. So first of all, first thing I do, of course, thorough history and physical exam and evaluation, lab testing. I think it's really important to look at the basics, like we talked about. Oftentimes when people have OCD and anxiety, I will also check a celiac test because actually there's a very strong association between celiac and mental health issues. And in research, they've even shown that there's autoantibodies that can be stimulated through celiac to your brain. Very similar to pandas. We can touch on that in a minute as well, because that's kind of an autoimmune encephalitis, or at least it's believed to be. That's a little more gray than I would say even the celiac. So a lot of times the patients I'm seeing who are diagnosed with celiac are coming to me with mental health stuff because the real easy ones, the kids who are like, failing to thrive, losing weight, diarrhea, they're getting picked up by their regular pediatricians. And so those aren't the ones that come to me. The ones that come to me are the more strange cases, like the kid who's all of a sudden hiding under their desk at school out of nowhere. And I had one case where that was the symptom, and then we got her on a gluten-free diet once I diagnosed her with celiac, and her symptoms resolved like in 48 hours. It was crazy. Now she did have a propensity for anxiety, before and after that. It wasn't like it came out of nowhere, but the exacerbation was huge. So I'll do lab testing, and then depending on severity, I'll start with some supplements to support the nervous system. Like you mentioned, inositol, that's one of my go-tos. I absolutely love that. You do have to use much higher doses for anxiety than you use for generally thyroid, for kind of like thyroid support. But you can. People tolerate very high doses of inositol. I'll use L-theanine a lot. I love that. That's an amino acid found from green tea. It's super safe. It's really calming. There's not a lot of research using it in pregnancy or postpartum, though I have met with integrative GYNs, OBGYNs who do use it. And I've used it like postpartum nursing, because you can give inositol and L-theanine even to an infant under obviously close supervision by someone who knows what they're doing, but you can. There's even studies using inositol in micro preemies, like 400-gram babies, and it improves their lifespan because inositol is really fascinating. It actually stabilizes blood sugar. It does all kinds of interesting things in our body. So those are kind of like the most basic ones. Of course, the basics: fish oil, probiotics, multivitamin, checking vitamin D, optimizing vitamin D. Vitamin D is associated with everything. So if you look OCD and anxiety and vitamin D deficiency, it's there. Hashimoto's, it's there. It's associated literally with everything. But that's for mild to moderate. If someone's doing okay and we have a little bit of a longer timeline and we can, improve diet, lifestyle factors, and then use some mild supplements. But a lot of times I'm getting patients who are absolutely suffering, debilitated from their OCD or anxiety. And then I will think about using some pharmaceutical stuff as well. Whether it's an SSRI, like Zoloft can be very good for people with anxiety and OCD, particularly in children. That's the main one that's been studied. Adding N-acetylcysteine as well, particularly for OCD. There's some really good studies. The main study I've seen is with Zoloft and N-acetylcysteine combined, but anecdotally I've seen N-acetylcysteine without Zoloft also help. So I think you do need to get to pretty hefty doses, probably like, again, more like 600 to the studies are very wide ranging. So like from 300 to 1200 per dose, maybe even as high as 2400 milligrams. So slowly increase it until you kind of see if you have improvements or if it causes any gastrointestinal side effects. But those are the main things I would say. And then therapy is incredibly important because people with OCD oftentimes do need to do therapy. There's different types, but exposure therapy, things like that can be very helpful and necessary. Often it's not the first thing we do because if you're so dysregulated that you can't do the therapy, it's not helpful and it's discouraging. So oftentimes I try to help people's symptoms come down first and kind of stabilize, but then therapy is crucial.
So I have as everybody knows, I have a 6-year-old, and according to Dr. Roy, he's one of the cutest kids ever, right?
Absolutely. I mean, have you seen him?
He's also one of the pickiest kids ever. So I know sometimes we can talk about like all of like these amazing supplements and things we can give to our kids, but if they don't take them. So you've introduced me to quite a few exciting formulas that like that I can actually get Dimitri to take. There was one from Zymogen.
It's one of my all-time favorite formulas called Relax Max. And the name says it all. I mean, it's actually good for a lot of different things, but yeah, it's magnesium, inositol, L-theanine, taurine, and GABA. Those are all things that naturally increase GABA. GABA is the neurotransmitter that kind of calms us down. It's like the brakes of the nervous system. It's one of the ones that makes us feel kind of calmer and whole and in control. So it's great. It's also a great supplement for ADHD because, interestingly, in natural medicine, most of the things that we use for ADHD and focus are also the same things we would use for anxiety. And I think there's actually, I just wrote an article about this on our blog. I think that one of the biggest problems with treating ADHD, not to tangent, is that you often have to actually address underlying anxiety before you can use a medication or even a supplement that's stimulating. Because think about anyone who's been anxious and drinks a Red Bull or a triple latte, you're going to induce a panic attack for yourself. So you have to calm the nervous system down before you can stimulate it sometimes.
Yeah, and I love Relax Max. I think it's like cherry flavor, and I started drinking it too. Like I drink it right before pickup, and I'm like so chillaxed right at the 3 p.m. pickup time for school. So, and it's tasty, and it's like sometimes kids can't swallow pills, so you have to get very very creative with um with kiddos.
If you have a really picky kid, I actually recommend the unflavored one, and then you can put it in whatever they like. So usually we'll mix it into like a thicker drink, like a little naked juice or like a Wallace smoothie, like just a shot glass. Because some kids are so picky that cherry taste I like it, but it's pretty strong. And so the unflavored is naturally sweet because inositol is a sugar alcohol. It's kind of like xylitol, so it's really sweet. People with really sensitive digestion need to proceed slowly with inositol. That's one little tip. I've not seen it frequently, but it can make you gassy and it can definitely give some people loose stools. Again, I think in just the most sensitive, digestively sensitive people.
I'm personally a big fan of it just because I love supplements that do multiple things and it can help with balancing blood sugar. It can be helpful for women who are in perimenopause and optimizing hormones. It can be helpful with like normalizing menstrual cycles, and it relaxes you. It helps you sleep better at night. It's like and then it tastes sweet.
And it's good for focus too.
It's good for focus, and it's also been noted to normalize TSH,
Yeah.
very like subclinical TSH, especially when it's combined with selenium. So I love that we can utilize some of these things in children. It's always, I'm always thinking about adults, and a lot of times the challenges that kids deal with, they might have the same kind of nutrient deficiencies that adults have, but it might show up in a different way than it does in somebody that's an adult. One thing that I've always wanted to learn more about is pandas, and I'm not talking about like the really cute bear, although those are awesome too.
That'd be more fun to talk about, to be totally honest with you.
Yeah. And this is a type of pediatric obsessive compulsive disorder, and that can be induced by an infection. And you've come to specialize in this. Can you give us a little bit more insight, like what it is and what it isn't, maybe?
Yeah. Yeah, and that's the like $1 million question, I think, what it is and what it isn't. I mean, really up until 10 years ago, I don't think one patient ever came into me asking about pandas. In the last 5 years, I think everyone whose kid has any kind of anxiety or OCD thinks or is questioning whether their kid has pandas. So pandas basically is a post-infectious autoimmune encephalitis, so inflammation of the brain, and it's believed to be caused by stimulation from strep, group A strep, the kind you get, regular strep throat. But there's also PANS, which is a little bit more broad, and that's really anything that causes some kind of degree of autoimmune encephalitis that's infectiously related. And I actually learned about this, believe it or not, even before it was named. I learned about something very similar because when I was in med school, I famously diagnosed somebody with rheumatic fever, which you really don't see a lot of these days. And so my mentor at the time turned me on to this book that was like literally, I mean, the biggest book I've ever purchased in my life, was thousands of pages, all about the different things that can happen with you when you get a strep infection. And there was 200 pages on neurologic issues and neuropsychiatric things. So people knew that strep was had the potential to cause this, but I think in early 90s. I'm not sure exactly when it was coined, but a woman, Susuito, she's a doctor. She coined the term pandas and started seeing a bunch of these patients who had this acute onset. So I think that's the key, is it really needs to be acute. So it's not like someone who's had anxiety their whole life. Usually it's a massive change in behavior, and it can look like obsessive compulsive disorder, anxiety, food restriction, like not anorexia nervosa, so not like for calorie restriction, but food restriction for fear of food. Um, what's like yeah, so that's a big one. Interestingly, sometimes people will have really like fine motor skills, so their writing will become really more infantile. They'll have regressive behavior. They can have a lot of rage episodes. So those are kind of like the most common symptoms we see. I think now that it's become kind of in fad, once it does, it loses its clarity. Like the margins become real gray because everybody's blogging about it. Everyone thinks their kid has pandas. There's no exact diagnostic testing for it. So very similar to like mold, where you can pile on testing that might suggest you have mold toxicity. There really isn't one pathognomonic test like a strep throat that tells you whether you have a strep infection, right? So we can talk about sort of diagnosis. It gets complex, but what I would say is that this is kind of a syndrome. It's not so much an exact diagnosis, but by using things like antibiotics to test if there's a huge improvement, or sometimes steroids to decrease inflammation, and then of course a whole host of natural things that we use, you can kind of get closer and closer. Does it seem like this is some degree of autoimmune encephalitis? I mean, there are groups like, for example, at Stanford, which recommend doing spinal taps and MRIs, but the majority of pandas doctors are not doing that, and the yield on that is incredibly low. And so I think we don't really fully understand what the kind of pathogenesis, like what's causing this, what exactly is going on. There have been some studies that have shown that there's some autoimmune antibodies to the basal ganglia, but those are not super consistent as well. So again, it's kind of this gray diagnosis, but I can tell you definitively, in my opinion, that I think it is a real diagnosis. Many pediatricians don't believe in it. Many doctors, infectious disease doctors, don't. I think that's going to change because Stanford has taken it on as a big project and they're legitimizing it, which I think is really good. But there's no standard of care for it. It's a little bit Wild West, to be honest with you. So people, do you want to go a little bit about like what people do? So I think, well, first of all, I think the important thing is if you're suspicious that your child has it, then it's worth finding a doctor who knows what they're doing. Like I think with mold and Lyme, some doctors who specialize in it will diagnose everybody with it. So you have to be careful a little bit with that as well. But if you find someone you trust who is a little bit more middle of the road, judicious, then I think that can be really helpful. And then there's a whole host of blood testing you can do that can be, again, suggestive, but not definitive in terms of the diagnosis. But the key is that it should be an acute change, pretty aggressively different. And then the other little key that I found, and this is, I think, I have not seen a lot of people talk about this, but this has been my experience. Virtually every kid that I've ever diagnosed with pandas, when you start asking the history, you'll find that there was something else going on before. So kind of like I felt with autism, like there was always like digestive something with autism, or a kid who was really fussy or colicky early on. With pandas, most of these kids will have a history of sensory integration issues or some borderline smoldering moderate anxiety. And then just like that overnight, it'll change. Actually, most parents whose kids have pandas will tell you the date and time that their kid changed. It's pretty specific like that. So yeah. And of course, there's the gray outliers that don't fit that story, right? So sometimes it is more of a indolent, smoldering picture. But But overall, it's generally more acute. So, and then the treatments, just to kind of go over real briefly. So treatments, of course, all the things you're going to use to treat anxiety, OCD naturally. So we're going to look at diagnosing thyroid, celiac, immune deficiencies, especially things like IgG deficiency. That's a real common one. So type of antibody IgG, and then other infectious disease, strep antibodies, things like that. But then in addition to that, then we're going to potentially use, this gets really controversial. I find that using SSRIs can be incredibly helpful and life-changing. Some doctors are really opposed to using it, but in my experience, maybe it's my patient selection. I feel like I've had amazing results, and sometimes that will be even curative in the sense that once you derail the nervous system from its loops that it's stuck in, you can actually get new, healthier neuroplasticity. But the treatment of kind of like choice, like the gold standard, maybe that's saying it too strongly, is IVIG. So it's IV antibodies. And there's like 7 or 8 mechanisms on how that regulates your immune system. It's good for a lot of different autoimmune immune conditions. But it can be shockingly helpful for some of these kids. Not all of them. Not everyone needs it. It's super expensive. The state of Colorado, just one of my clients whose kid had 2 kids with pandas, just got the state of Colorado to mandate it for when someone's diagnosed with autoimmune encephalitis. So we'll hopefully be able to use it a lot more, but it can be very expensive if you pay out of pocket. Actually, where you're from, Izabella, from Chicago, there is a famous doctor out there who's one of the kind of premier pandas doctors, who does IVIG, but I think mostly people have to pay cash and it's really expensive. So I found low dose naltrexone, interestingly, I know people use that for thyroid. I've used that as well for pandas. It can be helpful. Like with thyroid, for me, it's been very hit or miss. I don't know what your experience is with LDN and thyroid.
50-50.
Yeah, okay, right. So I'd say maybe less than 50-50 for pandas, because I think pandas is really complex, but I think it's certainly worthwhile, and it's such a benign intervention. It's even more benign than IVIG, which I would argue is relatively benign. So I've used that successfully at times. Yeah, it's a really hard condition to diagnose and treat, honestly. But
A question for you. So, backing up a little bit. So, I know with like rheumatic fever, what I learned about it in school is if you don't treat a strep infection, you can develop rheumatic fever, right? Is that the case with like pandas? Like if somebody has a strep infection and maybe they don't get antibiotics or they don't finish their antibiotics, does this increase the risk of pandas or is that not related at all?
yeah, it's a really good question. I don't know the answer to that. I don't think that that's been shown. As far as I know, I don't think it's similar. With rheumatic fever, there's actually really specific rheumatogenic strep species, or like a strep strains is the proper word, that cause it. Whereas pandas, I don't think that's been delineated yet. We don't know. Is it specific strep strains that cause pandas, or is it any strep? My feeling is that I think it's more about the host. I think it's more about the individual and their susceptibility to infectious disease, to the kind of maybe their integrity of their blood-brain barrier. Again, this is just kind of understanding physiology and thinking it through. I don't have any science to prove this, but I think that's why I feel like almost all the cases I've seen of pandas are kids who are susceptible. They're kids whose nervous system wasn't fully normal to start off with. They're more like neurodivergent kids, I think, are at higher risk.
Um, One thing that you guys taught me about was a certain probiotic to prevent strep infections that you use in your practice.
Yeah. Yeah, so unfortunately, so that used to be a Zymergen product too, and they stopped making it. But there are, you can use a type of strep salivarius. I can't remember who makes. I wish I remember. There are some other companies off of Full Script that have it, but I can't remember. But like basically, you want like a good oral probiotic. There's not a ton of research, but there is some research on using strep salivarius to prevent strep, group A strep, because group A strep specifically is the one that causes strep throat. Now, I've seen, because of PANS, which is kind of like pandas, but not with strep, Epstein-Barr virus, COVID, flu, all these viruses seem to be able to stimulate. Mycoplasma is a big one. That's another bacteria That's a real weird bacteria that kind of intracellular can get in your cells. So mycoplasma has been implicated, and I've definitely seen that before. Um, yeah. So, and the other weird thing about pandas is sometimes treating a kid with antibiotics, even when they don't have an infection, seems to help them. And that's, either we're not catching their infection or the antibiotic has another effect. We know Zithromax has anti-inflammatory properties. So it's kind of still not 100%. We still don't know enough, unfortunately, but it's rapidly growing, the knowledge.
Yeah, it's fascinating. I was going to ask if you ever utilize like antibiotics or antimicrobials when you have a child presenting with these symptoms to see if there's any like residual infection.
For pandas cases, like kids who have recurrent strep or every time they get strep. I mean, we even think about things like tonsillectomies. I mean, there's some Dr. K, the guy in Chicago, he's big on tonsillectomies and believes that they have a huge a benefit, particularly at staying in remission from pandas, an improvement of outcome with IVIG. So, I mean, he has a lot of experience, and he's actually done some good research on that. So, um, yes, antibiotics. Again, sometimes it's worth an antibiotic trial. I mean, as a holistic doctor, giving people antibiotics is it's like a thorn in my side. It's obviously there's a time and place to use it, but it's not something I certainly the thought of putting someone on antibiotics for months or years, more like a year, is really like against my personal philosophy. But I will tell you, when you see these kids who are absolutely suffering and it works and helps them, it's a lesser of evils, because I think staying in a state of severe OCD when some of these kids are like, running out of the house into the street and, it can be really, really dangerous. So sometimes we need to use things that I wouldn't normally use. But yeah, absolutely. Antibiotics can be very helpful. And sometimes if someone's getting recurrent or we think that's not clearing, we'll use even something more intense like clindamycin or something to really get it out of the tonsils. So yeah, not my favorite drugs to use, but there's a time and place for everything.
Absolutely. I think that's rather than like adhering to dogmas, I think it's really important to look at the person as a whole and see what kind of tools you can pull from your toolbox to really help them. So I love that you combine, Western medicine with integrative functional medicine to get the best results for your patients.
I always joke that I'm dogmatically non-dogmatic. Like I'll use whatever I feel like is safe. Especially being in pediatrics, I probably have a much larger safety buffer than most of my functional medicine counterparts in adult medicine. But kids are not little adults. They're developing, and it's much more of a delicate time. And you have to be more careful. They have a long life ahead of them, and they can't consent the way adults consent to things. So I'm very cautious, maybe more cautious than others, but that's my personality.
Now it's time for some rapid fire questions.
All right.
Best advice from postpartum moms as a pediatrician.
I mean, I could go on for maybe 3 hours here, but I would say the most important thing, because I can imagine that your audience are generally overeducated or highly educated. Maybe that's a better way to say it. Highly educated, proactive, um, maybe a lot of perfectionists. I might guess, like myself and my wife and all of our friends. Yes, exactly, just like that. I mean, that's the clientele that I tend to have living in a town that's a highly educated, really. Just, I mean, the people here are so crazy smart. So that's great, but the downside to that is you cannot type A your way through parenting. Um, Parenting is more intuitive. You got to trust your gut. I guarantee you, if I took any of you and threw you on a deserted island with your baby and enough food, you would survive and you would be a great parent, and you would instinctively know what to do. So I think it's like I'm all for research, but you got to know yourself. Like, I do not get anxious the more I learn, but I know a lot of people to do, and I think it's also, parenting's high anxiety. It can really stimulate anxiety for a lot of moms, and so I would say just take it easy. When I was in med school, I watched this video on good enough parenting, and I was like, of course, super type A at the time, and like, that's terrible. How could anyone use that term? You should be as good as you can be. And I think it's the same, really. But good enough is sometimes good enough. I mean, take it easy. Don't try to type A. You cannot be perfect parent. You're definitely going to cause some damage to your kids. It'll be probably pretty minor. I've got amazing parents. They did the best they could. I still had to work on stuff. So yeah, that's my number one advice. I could give millions of other things because I've, been doing this for 20 something years. So
I love that. That's such great advice and personally very relatable to me. I know I had like read all the baby books and my son apparently hadn't. So I was like, what is going on? He's supposed to do this at this stage and this at this stage. And he didn't go by the book. And I had to, it's been definitely a personal growth journey for me. And thank you for all of the support that you've provided when I've called you and, you know,
my pleasure. I would say the same thing about health. You can't type your way to good health either. Type A your way to good health either.
Um, rapid fire question. What do you wish most pediatric psychiatrists would do differently?
Um, I think the main things would be to look for medical causes or even medical contributors to the mental health, because even though if the medical condition, like let's say Hashimoto's, obviously that's your audience is probably big topic. That might be contributing, but it might not be the cause. There might be multifactorial. It often is. But I think that's the biggest thing. It's just not looking for things holistically. I think we often use the term root cause, and I think that's a bit of a like, it's an exciting term, but oftentimes we don't find the root cause, but we find like many root causes. We find many root contributors. And so I think that that's the biggest thing is just not looking at things in an integrative way. You have to look for medical causes of mental health stuff, and then the other thing is just not understanding how to use supplements and nutritional supplements, and nutraceuticals, which can really help and sometimes make side effects from medications lower. ADHD is a great example. Like if you give someone a stimulant and then you give them magnesium, oftentimes it can offset the irritability of the coming down off stimulants. Same with lithium can do that. So just again, just really being too focused and maybe a little narrow-minded in their approaches. That would be my biggest complaint.
I agree. When I was like a junior pharmacist, I remember I had a bunch of patients come to the pharmacy that were taking Effexor, and we had a blood pressure monitor, and they were like, "It's really skyrocketing my blood pressure." And this was like a thing that I noticed like my first year of being a pharmacist. And I remember working with a psychiatrist a few years down the road, and he was like, "Oh, I just love using Effexor with my patients." And I was like, "Does it ever impact their blood pressure?" He goes, "I never test their blood pressure." I'm like, "Okay." It's like really looking at the person as a whole. I fully agree with you on that. Um, what do you wish parents would know when their children have thyroid problems or mental health problems?
Yeah. So I think one of the things that's really important is if you're suspecting your child has thyroid problems, um, is to test frequently, because you can go many years with sort of like subclinical, which basically means your TSH is not out of whack enough, but have thyroid symptoms. And it's good to watch trends. So sometimes I'll see somebody, because kids can have higher TSH, as we mentioned before, it can be harder to diagnose. But watching trends, if I'm seeing more and more thyroid, the kid who's constipated, and then now she's having hair loss and she's cold all the time and, starting to have insomnia and anxiety. And it really looks like thyroid. Just keep testing the thyroid, because sometimes, not always, but sometimes it's going to come back. And the sooner you catch it and can jump on it, the better. So that's number one. Mental health, I'd say the thing, and this is not just for kids, but for parents too. Having baseline anxiety is not normal. We accept it because the life we're living is very anxiety provoking, but you shouldn't feel anxious all the time. And your kid shouldn't feel anxious all the time either. And, sometimes it's changing lifestyle things. Many, many times, changing very basic foundational lifestyle things can make humongous differences, like getting enough sleep, getting off your media, things like that. Sometimes you need to meet people where they are. They're not ready to do those things. So sometimes we'll use medications or supplements, and then hopefully keep working on chipping away. That's where Debbie, my wife, is amazing. She gets people to do things in a very kind of gradual, very supportive way. I always say she gets under people's skin in a good way. Um, uh, she's very motivational. So working with someone who can motivate you, keep you on task. But that's the big one. I feel like too many people walk around and accept their level of anxiety and as like it's normal. You shouldn't feel anxious all the time. Anxiety is an important tool. It tells us when something's wrong, but you can't feel like something's wrong all the time. Then it's probably more us. Um, I didn't mention mindfulness, but obviously my practice is called Mindful Pediatrics for a reason. That's a good place to start.
I love that. One thing I wanted to cover real quick is thyroid symptoms in children. Can you give us a list of those to for people really to consider?
Sure. I'll tell you the ones that I see most commonly. And of course, you get the outliers. I've diagnosed like 3-year-olds with Hashimoto's, but that's really, really rare. Okay. So that's going to be a bit of a lucky catch. Like you're going to look for it and you're going to catch it. But the most common ones I would say are things like anxiety. I'd say is probably my number one. Sleep disorder. So like insomnia, fatigue, obviously. Very similar symptom to adults, but constipation, reflux sometimes I've seen because they'll have like mild constipation, but it'll present more in upper GI symptoms. Um, what else? I think those are the most common ones. Dry skin, weight gain, that's a big one. Menstrual, oh, of course, because the most common time we diagnose Hashimoto's is in teenage girls, peripubertal, so right around the time they're getting puberty. So change in menstrual patterns. I always encourage females to have a menstrual tracking app, or like my wife used to do for many years, on a calendar. Um, it's such an amazing way to tell if your body is functioning properly, besides knowing if you're getting pregnant or not. When your menstrual cycle goes out of whack, it's very common that something is wrong with your health. And it can be one of the first signs that something is off. So it's good to track it and understand your patterns.
Mm, such great advice. And you have a college student, a teenager, and an elementary school child. So you
Yeah, no, so actually I have a middle schooler, a high schooler, and a college student. So Mia is, I know, she's 14. She's going into high school next year. So it's crazy.
Okay. One of the things I'm super excited about is that you were our pediatrician in Boulder, but now you're available to provide consultations all over the world.
Yeah. Yeah, so I do like there's a sort of like sort of definitional importance. Yeah, I see patients all over the state of Colorado as patients. I can prescribe, order lab tests, do everything like they're regular patients. There are some caveats, of course. If we need to do controlled substances like stimulants, then I do need to see them in person at least once. Out of the state of Colorado, I do kind of what we call educational or distance consultations where I can work with your local doctor or work with you to work with your local doctor, where I can help guide you with all these things. Maybe help you think through things that your regular doctor's not working through. But I cannot order lab testing or order prescriptions or things like that, just because I'm only licensed in the state of Colorado. So, but I do work with people all the time out of state, just in a slightly different way. It's generally very helpful. And a lot of things don't require medications or lab testing. And these days, people can order their own labs too.
I was going to say that people can self order their own labs these days. And a lot of times I go through Ulta Lab, and many people can submit the lab work to their insurance. Not every insurance company will reimburse them, but this is always an option for people.
It's harder with kids because most of those like Rupa, I'm not sure about Alta, but like Fullscript, they don't do kids yet. So I'm in discussions with Fullscript. I'm really trying to help them move that through faster because I think that'd be a huge thing. It gets more complicated when you do it with pediatrics, but a lot of times I'll give you a list of I'll give you a list of labs that I recommend, and people will take it to their doctor, and they may not order all of it or all of it 100% correctly, but they very frequently, if they have a good relationship, will be willing to work with us.
Yes, I love that. And everything is a little bit more tricky with kids. I know blood draws for my son are just, not never his favorite thing to do, right?
Uh, Absolutely, yeah, yeah, and that's part of being judicious, and that's one of the scary things I see when people go to like a functional medicine doctor or someone who's not trained in seeing kids. They'll come back with a list of things that I have to then like nope, 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 because you can't get 40 vials of blood from a kid. They won't even sit still for that long, and you often have to hold them down, right? So yeah, you got to make the list short and potent. You want it to be important.
Absolutely. Where can people learn more about your work?
So our website is probably the best place. We're just so mindfulfamilymedicine.com or mindfulpediatrics.com. It goes to the same place. If you go to that website, you'll see me and my wife Debbie, who's our nutritionist and kind of health coach, counselor, nutrition counselor. Um, and then we're going to be starting to post more on things like Instagram. I'm working on it right now. So eventually,
I'm excited for that.
yeah, yeah, Facebook and Instagram, I think we'll post on. I'm just in the phases of understanding how to do that.
It's a steep learning curve for sure, but I think it's really fun to get out there and be able to connect with people.
Yeah, I'm actually really excited to do it. I feel like after all these years, there's enough to offer, um, and I think there's not a lot of pediatricians out there doing what I do, so I think it's will be useful.
Yes. Thank you so much for the work that you're doing. And thank you for taking time out of your busy schedule to be here with us. For everybody listening, thank you so much for dialing in. And hopefully, this conversation has been healing to you and your family.